A special report tonight. It is a public health crisis for teens. Schools, states, and now the federal government are trying to figure out how to stop kids from vaping. But one generation's crisis might be saving another. U of A student Abby Davis sees it every day.
It's just everywhere. Almost every single person I know is doing it.
Davis was in high school right as e-cigarette popularity spiked with teens.
Since so many of people in our society are doing that they just think it's okay and that it's not going to harm them in any way, so they continue to do it too.
Look at the numbers. Tobacco-related incidents have gone up in Rogers schools each year since 2015. In Bentonville schools, the numbers are even higher. Tobacco-related incidents doubled from 2017 to 2018. Then, it doubled again last year. Superintendent Dr. Debbie Jones said these are almost exclusively vaping-related incidents.
We don't see traditional tobacco anymore. We see vapes.
That's the trend around the country. According to the CDC, now 27.5% of high schoolers vape and 10.5% of middle schoolers. The issue was virtually non-existent 10 years ago. Now 17% of our kids are vaping. Davis showed us how easy it can be to hide.
It looks like an Apple Watch, and you just press this button and you pop it out and it's a vape.
That has led to other issues.
One of the scariest things for me is seeing students easily transition from nicotine in the vapes or e-cigarettes to CBD or THC, and we're seeing that in the schools now.
Vapes, many with THC and other additives, have been linked now to EVALI, a type of lung injury. There have been 23 cases of it in Arkansas, 2,500 cases across the country, in patients as young as 13 years old. 54 people have died from it, including a 15-year-old.
I think this is just tip of the iceberg.
Dr. Navneet Kaur tells us these are just the short-term issues.
There's a lot of study that's going on trying to figure out what exactly is in e-cigarettes and vaping that's causing this lung disease.
But what has become a public health crisis for our youth just might be saving some of our adults. A new study in the New England Journal of Medicine shows e-cigarettes are helping smokers kick the habit, and it might be more effective than the patch or gum. 18% of e-cigarette users in the study were able to quit smoking. Only 10% of patch and gum users were able to quit. But the same study showed 80% of those who used e-cigarettes continued to use them a year later. Only 9% continued using the gum or patches.
You're eliminating a lot of toxic substances like tar, smoke, carbon monoxide.
But there are other additives to worry about with vape.
There are still a lot of additives and things that are in the e-cigarettes. We don't know if they're safe for long-term use.
And those unknowns are raising a lot of red flags.
Even some of my friends know that it's a really big problem, but they're too addicted now to this point of the nicotine effect, and so they just can't stop.
And by the time we get some answers, Davis worries it might be too late. Tomorrow night on knwa News, we continue our conversation on vaping. We look at all the different ways governments are regulating the devices, from total bans to embracing the new technology. That's coming up on knwa News at 10 tomorrow.